Usually at this point, Gina's been saying some very choice words, so
I'm trying very hard.
she's doing very, very well. How's it going, everybody? It's Dr. Nick here at Kalkstein Chiropractic. We're here today with Gina.
Hi.
Gina is a very unique case, so kind of want to introduce you to you guys and just kind of talk about what we've been doing with her. Gina's been coming to us for 3 weeks?
No, longer than that.
Longer than that? Maybe a month?
Yeah.
She initially came in with primary low back pain.
Yep.
And then some older stuff, some left shoulder discomfort. But the big issue though for you is?
My lower back.
Your low back. Okay. And this all started when?
I would say five years ago or something, but
Okay.
maybe it could be like before that or something. You know, it's been a long road.
She has a track history of injuring herself, very extensive. The most prominent being?
I don't know if I can name just one.
Okay.
It was kind of a snowball effect, I
Yeah.
think, that I was receiving cortisone shots for, and you could say the day after a soccer game, I was like, uh-oh, and it went downhill very quickly, and it just progressed over time from cortisone shots and seeking out chiropractic help to then surgery. So,
very active, young as well. So it's unique to see how much work she's had done on her back prior to coming to see us here.
Yep.
So the shots worked until they didn't. Is that reasonable to say?
Yeah.
And then you sought an ortho consult. Two orthos. Yep. You had 1 or 2 surgeries.
1 surgery. When they went in there, I had a microdiscectomy, but he said it's really not a micro. He's like, you lost your disc between your S5 and L1, and then they would go in there and determine if I needed a full cage. So at the moment, I just have that one. Just that disc is gone, and all the PT and then chiropractic work to try to keep me moving and happy and less pain.
So when she says her disc is gone, they didn't cut all of it out with the surgery. They cleaned up, some debris where it was hanging out where it shouldn't be. So they cleaned it up. They're referring to probably degenerative disc disease, where the disc slowly starts to wear out and get flat, and you lose height. So you're not really losing too much, but you're just losing that cushion aspect of the disc.
Ruptured into my spinal cord.
Exactly.
And so I had nerve damage.
So she had probably a sequestration, a herniation.
Yes,
a sequestration is when fragments of that disc are free floating.
Yeah.
Within.
I saw it in my MRI. It was like it was. Yeah. I remember seeing the look on their faces, thinking like, "Oh, I'm just a wimp from the pain," and then they looked at it and they looked at me.
No,
I was like, "Can I see it?" And I was like,
yeah.
And they were like, "Yeah," and they booked me for surgery.
So in situations like that, surgery is a very good thing because it's clearing that tissue out, because it was interfering with nerves, and we don't like that. We don't want to see that stuff. So she did the right course of action. She got it cleaned up, but now she still, of course, has some discomfort associated with degenerative disc, loss of disc height, extra wear and tear on the joints and stuff like that. She plays soccer.
Yep.
You ride horses?
I ride horses.
Yep.
I wakeboard, snowboard, wake surf. And I do lots of sports. I raced cars for a while, so granted, no bad crashes, but you have to have a very strong core when you're you're getting jostled around a lot. I don't know. If it's a fun sport and there's adrenaline involved, I've probably done it.
She's a bit of a junkie.
Yeah.
So what we've been doing with her is manual work, of course. We've been doing some dry needling. She responds well with traction, and we're implementing some more strengthening stuff, but also McKenzie's, right? We've shown you how to do some McKenzie's. Cool. Let's get you adjusted first, then we'll go from there. Let me get you on your stomach here first.
I'll bring this with me, I guess.
You can if you want.
Do I need to? Want me to hold it? If you don't want to, I'll take it. I don't know what to do with it. It's your video.
I'll double it up. Will that mess with the audio if I double it up, Carly?
And I can hold it. Whatever
cool. Yeah, go in your stomach. Otherwise, it'd be clipped to your chest, and it would just be listening to you breathe the whole time. I feel special anyways with 2 microphones, so.
You are special.
Thanks, Gina. My mom tells me that every morning. So outside of the low back, what were the other problem areas?
Like up in between my shoulder blades, where you've been getting it, and then you did the other one on that like table in the hallway that was awesome.
Yeah, the hands over the head.
My, you always get my neck, like I think I clench my jaw from stress, and when you adjust my neck, it always feels like really, really good. And then working on my shoulder from that separation a couple months ago.
She has maybe a grade 1 AC joint separation from doing what?
Getting tossed off the track thoroughbred.
Yep, riding a horse. All right, take a breath in and let it out. Good. A little bit higher up. Breath in and let it out. Good. Let me get you right side down first. Cool. Let the knee bend. And then I'm gonna tuck you like that. Good. Other side. For as much as she's damaged herself, she moves very well, so.
I find people to take good care of me.
You just have to find the portion of you that wants to take care of yourself as well. Go on your back.
Okay. That was a good one. Can we not record the knee thing?
The knee.
Can we not? I don't think that's.
You don't want to squirm and be uncomfortable?
I can try.
No, we don't have to.
I mean,
Good.
I don't know if that's good for people to see. I don't know if that makes for good interviewing.
No, we don't have to record you suffering for other people's enjoyment.
I mean, it works.
A little pull. Same thing right here. Good. All right, so next we're going to jump out to dry needles. You've already had decompression therapy, right? The traction?
Yes.
Cool. She did that first.
Busy day today.
Yeah. So we're going to jump out to needles. I'll see you guys there. So this is Gina's favorite part by a long shot.
It's useful. It helps. I just don't.
She doesn't like it.
Yeah, she's got to unlock in there.
So for the month that we have been working with Gina, most of it right now has been kind of the pain management side of things. So I want to get her feeling like a normal human again. And then when she gets to that point, we're definitely going to start tapering off the passive stuff. So the needles, the traction, stuff like that. We'll start to incorporate it only when she needs it. But at that point,
Read the first sentence.
she's going to take in a more aggressive, active role with her time here in the office. Of course, if any of these are too painful, all right, you let me know.
She had that one lady.
Say again?
Some of them don't hurt at all.
Yeah.
That nerve.
The ones you feel the most are finding their way into a very fun trigger point. So through here, I like to get through the lumbar erectors, get it down deep enough to hit the multifidi, And then from here, we're getting portions of her QL, or quadratus lumborum, which is a fun, tiny muscle that sits between the top of your iliac crest and the lower portion of your 12th rib. That's responsible for some side bending, maybe a little rotation of the trunk. But when you have as much going on as Gina does, these muscles get very tense and very tight because movement's a little provocative to this region. So they're on lockdown trying to prevent a little bit of that movement so she doesn't make anything more unhappy than what it is. Yeah, fun one. I'm going to trade you spots here where we can work up the left shoulder.
He's earned his stomach from over there. The last man standing. Almost we do.
Usually at this point, Gina's been saying some very choice words, so
I'm trying very hard.
she's doing very, very well. Not being a sailor.
To enjoy this. I'm trying very hard.
I don't enjoy hurting people as much as you think I do.
I don't think you really enjoy it, but also if I say the wrong thing, I end up laughing.
And that is not comfortable.
Yeah, laughing with needles in is not
No,
a
no.
cool experience. I've had to sneeze once with needles in my neck, and it was, you know, borderline traumatizing. So right now we're getting through the upper portion of her trap. Out through here, I'm getting through her AC joint capsule. And at this point, she gets to hang out and cook like a rotisserie chicken for 10 minutes. You cool with all those?
Yeah.
Awesome.
On the right side?
No, not today.
Cool.
Not today.
That wasn't as bad.
Good. You are hanging out for 10. Of course, if you need anything, just use your outdoor voice and holler. We'll be in to help.
I'm good.
Cool.
And then you're going to hit me with the stem, yeah?
Yeah.
Yes.
Awesome.
My next favorite part.
Good. Good. We'll see you in a bit.
Thank you, Dr. Nick.
You're very welcome.